In the U.S., new cases of COVID-19 have been falling rapidly for 2 weeks. Many are looking toward a return to some sort of normalcy and a lifting of restrictions.
We have to recognize that we're going to be living with COVID for the foreseeable future. We need to have a reasoned conversation, establish the benchmarks for when restrictions can go, with the understanding that they may need to come back if we have a new, more threatening variant in the future.
New tools may soon arrive in the fight against the pandemic. Pfizer is expected to request emergency use authorization in the U.S. for its vaccine to be used on children 6 months to 5 years old. Authorization could come by the end of the month. And Moderna's vaccine has now been granted full FDA approval. It has been administered under emergency use authorization in the U.S. for more than a year. But even as new cases fall, many hospitals are packed, pushing healthcare workers to the limit.
Of course, we're all, burnt out to several different degrees.
I don't think the public understands necessarily what we're still seeing and dealing with. I think nurses and doctors, we just keep going even though we're tired, because that's what we do.
And a new World Health Organization study finds a massive increase in medical waste associated with the pandemic, as millions of masks, gloves, test kits, and other waste are ending up in landfills.
We found that COVID-19 has increased healthcare waste loads in facilities to up to 10 times current volumes.
The WHO is calling for an increase in recyclable and biodegradable materials, plus better systems for managing waste, especially in developing countries. Jim Spellman, CGTN, Bethesda, Maryland.